Right,
what brings you in?
I have a mid back pain, low back pain, and with the mid back pain, it shoots out towards my ribs.
All right, can you show the viewers where the ribs? Just turn around a bit.
So it'll be mid here, and then shoots out.
All right, got it. Anything else?
The low back pain, and then the right hip. If I move a certain way, it feels like it's pulling, and it's like an uncomfortable, sharp pain.
So, any particular event that you recall that triggered that right hip pain?
Yeah, I was deadlifting, and I believe I moved a certain way, and I felt the sharp pain at that point. And
Okay, how much weight were you lifting at the time?
it was over 300.
Over 300 pounds.
Yeah.
And you had no spotter or anything like that?
No.
And it wasn't a Smith machine, just free dead weight?
Yeah, it was free dead weight.
Got it. Okay, face forward again. So we got that. Okay, and let's see. Close in, what else is going on? We're talking about the knees?
Knee pains, both of them hurt. I had right knee surgery a couple years ago. Never got the left one done.
Yes, yeah. Yeah, you have a little incision over here.
Yeah.
Okay. And you got some laparoscopic incisions on there. All right, so you had some work done on there. And what was that?
I was probably like 2010.
9 years ago.
Yeah.
Copy that. And what else?
And then my left knee was started hurting after the right knee because I believe I was favoring the right knee much. And then I just never took care of that one.
All right. Okay. And Phil, so what's going on with that foot?
And then the left ankle, I remember playing basketball, I sprained it badly. I just let it go heal on its own.
When was that?
Probably like 2016, 2017.
All right. So 2-3 years ago.
Yeah.
All right. Anything else?
I had a deviated septum surgery done 3 years ago. I feel like it's better, but probably it's still a little misaligned.
What trouble do you still have with?
Like trouble breathing through one nostril. One of them is more open than the other.
Oh, which one is?
Left is more. My right nostril is more open.
So the left one's more restricted?
Yes, more restricted.
Okay. All right. Anything else?
Nope.
All right. Let's take a look. All right, Jim. Let's go down the list. So right now we're just checking for that abnormal temperature. That's an indication of local inflammation. Got something on that side. Let's see, I believe we saw a chronic one around. Yes, we do, right there. Is that tender right here?
Yep.
How tender is that? Here versus here.
Yeah, I'm feeling anything there. I feel pain.
So you don't feel anything on the left side,
No.
but this right side
Right.
makes you jump a bit, huh?
Yeah, right there.
Right here. All right, so let's see. How's this fellow over here?
Tender.
Tender as well, but not as much as this top part.
Correct.
All right, so there's quite a bit of swelling right over here, right? There's also some swelling over here as well. Some swelling in the medial side, but mostly right on the top part. Right? So that's a possible indication of a PI Ilium that we need to address. Yep. See, that side right there, that's fixated, that's stuck. Yeah, that's something here. How's that feel right there? Yep. What that did for you?
Pain.
Pain where?
Right where you're touching and shooting through the ribs.
Shooting into the ribs.
Yeah.
Is that the same ribs what we talked about before?
Yeah.
Bingo. There we go. That's the fellow. Yes, it is. All right. All right, so this is what I see on here. We tested confirm it's this right ilium. That's the one that's in trouble. And what I also see over here is that we also see this there's some swelling right in the sacroiliac joint over here. It's a little more enlarged compared to your left side over here. And on top of all that fun, based on the mechanics, telling me during history, doing a proper deadlift, Yeah, so what happened was, in essence, this hip over here, it knocked backwards going this way, right? So we need to realign it this way. Now, based on also what I'm seeing the lumbars, the way it's rotated, majority of the times, when this thing starts to misalign, it usually misaligns going this direction, not this way, right? So what we want to do is, there's a particular strategy for the young guys and doctors and students. We want to do a push maneuver. We don't want to do a pull, right? And also, we also see that in the lateral too. We have too much of this curve over here. This is from a classic PI Ilium. That's what happens to it. Because if it's the other way around, if the pelvis went forward, the spine would be a lot more straighter. But instead, no, we have too much curve here. Okay? So that's the reason why we're going to address that PI Ilium. Now, next component, we test confirm, is that second lumbar, all right, that's also in trouble. That's aggravating the rib, and we can see that here too. The ribs over here, see what happened over here? It went that way. So clearly something is not normal here, all right? Part of the reason why all these ribs are doing the way they're doing is because everything's being torqued up. There's too much rotation. In essence, what your pelvis is doing right now from the foundation, it just did that. So you're feeling all this tension right here, that little torsion, all that twist. So all that ribs, all that stuff, yeah, no big surprise. Once we address and restore the biomechanics, you'll start to feel the relief over here. And we want to double check if we need to correct that second lumbar or not. Okay. Next component. All right, the knees. You told me that surgery, okay, you had some kind of reconstructive repair over here. So ideally what I see is symmetrical. I want to see these heights the same. This is narrow, and we see this is taller, right? And on top of that, the way this is gapped over here, it's telling me that the way your knee went is, it went this way. So we're going to confirm it on you, how this thing really misaligned, because considering that they did surgery onto it, it's going to be altered. So I need to double check on you how this thing is really misaligned, and see if it even warrants a correction or not. It also may be compensating from that right hip. Don't know yet. We're going to retest that after we correct your right hip. Right? And this one over here, right? Same story as well, narrow on the medial side and also taller on the lateral side. So this one we got a PX tibia. So that's that one. I do need to double check on you as well and correct it as necessary. And then the fun part. This foot over here, I need to double check on you as well, because what I see is we have pes planus. That means this foot, we have a flat foot. Right? Everything else is starting to collapse. The talus itself is sunken down that way. The calcaneus is somewhat in alignment, but it's just navicular. Right? This is what this bone is. Right? My apologies, I don't have a other side of the foot, a left foot over here. This bone over here, what happens is it went a little higher than it should. Okay? But this one we need to realign it, and then I need to double check that first metatarsal bone over there as well. All right, let's roll. That's all. Walk on.
Wow.
Oh wow, what?
I feel lighter. Pain is still, it's not as bad as it was when I was doing this before.
Uh-huh. How's the ribs?
A little better.
So which side is worse, the left side or the right side?
For the ribs or the hip?
No, the ribs.
Well, I don't even know anymore. It's gone.
All right. Have a seat. Let's duplicate that. Let's double check your second lumbar. Give it some nice hug.
How's that feel right there? Well, it's moving now. That's good. And how's this?
Feels fine.
No more tenderness.
No.
How's that feel right there?
A little tender still.
Yeah, it's still out. Yeah. Gotta fix it. All right, knees back. Good. Draw out the belly. Just relax. Good. Hands right over here, please. Just relax. Just relax. Just relax. A little more. Just relax a little more. Just let it drop. A little more. Okay, that is really jammed up. Okay, plan B. Let it all go. A little more. A little more. Keep on, let it drop. Keep on drop. Relax this over here. Just let it all go. See, you're all tensed up here. See this? Yeah, all those muscles are all tensed up. You just gotta relax a little more. Nope. Okay, we'll go plan B. Come on up. Right over here. Step on here. As we can see over here, this is a lot more relaxed now. So this is going to be a much more easier set now. All right. Yeah. Sit it this way. A little more. A little more. Oh, belly. That is jammed. A little more. Let it drop. Let it more. Relax this over here, champ. Yeah, that's relax. A little more. Last one. Well, I could tell this is not gonna move. Nope, no, I didn't do it. Okay, plan C. Pardon me. Okay, right back here. What is that? Please trust me. This could be really small. Okay, come forward. Straight out the leg. Bend this over here. There we go. Lock the load. Oh, Nikki's last attempt. Nope. Come on up. That felt stuck. Yeah, walk around a bit. There is a D, but we'll see. Have a seat. How's that now? Not too bad, huh?
It's not so bad, but tight.
Yeah, it's tight, all right. Okay, stand up. Get over here. Draw the belly. Let it drop. Knees back a little. Just a little more. Stop right there. Let it drop. Oh, that's perfect. Drop a little more. Pump this up. Okay, calm down. Just breathe. I know we just took a lot of tension out of that fella. Just holding it in place. Okay, we're gonna bring it up. All right, Jack, come on up when you're ready. All right.
Oh my God. Feel a lot better? Just a little micro pinch, but
I know it was intense, but how's the ribs now?
It's still tender, but a lot better.
Nice.
Breathe better.
Good.
I feel like I'm more straight too. It hurts still.
I know, because no, that disc was very swollen in there.
Mm.
Right, that's what we see over here. That disc is pretty swollen in there. That's a little tough to get it, you know, to set that back onto that disc over there. We got it done. It just took a while to get in there. So I understand it was quite a bit under tension over there.
Yeah, right now it's just very tight everywhere. Here and in the rib, it's just like, it feels sore.
Well, that's a
Very sore.
starting.
Yeah.
So right now, just let it calm down. So when you get home, I'll just ice that right there. And this spot right over here, 20 minutes every 2 hours, just for the next couple of days. So it calms down. Then you start noticing everything else will start straightening itself out. Okay, it'll take some of that tension off.
See that now? That's moving beautifully now. You understand there's muscles over here. You feel that? That rib? Okay, that's now in proper place. This one is also in proper place. That's why you feel all that the tension just came right off of it. Now I said there's still some muscle spasms over here. Right? Just let your body calm down. I just gotta ice that down a bit. Now let's take a look at those knees. Okay, so this is the one with the surgery. So let's see what they did to it. Now bear in mind, right? Any time there's surgery being performed, it may alter the biomechanics. So that's why I need to confirm. Even though X-ray says one thing, I need to confirm it on you. See if it actually is functioning the way it should. Because X-ray is only a static image. It's not a full 3D, the motion X-ray there. So this motion, feel that? That's loose. This is stable. So this does confirm the tibia is misaligned, just like what I see in the X-ray. See, now this is different. Now according to the X-ray, it should be stuck here. It's not. It's too loose. Whereas over here, that's normal. All right. So it tells us, no, instead of an AEX, this is actually behaving more like a PX tibia. So we're just gonna pump this up. And we're not gonna set this thing. Okay, walk around.
Doesn't hurt.
Doesn't hurt?
Not as much as it did before. I wasn't able to go down on the right knee as much as before. That's the first I ever went.
Hey, nice. Have a seat. Let's take a look at the left one. So I'll tell you what. Okay, that's the reason why I didn't do a full thrust on this, because I don't know exactly what they changed under this. Okay, so next time when you get a chance, get the MRI CD for this knee over here, and we'll go over together and see what happened to those ligaments there. Okay. Okay. Now let's check this one here. Same deal as well. See, this is loose. This is stable. So we have a tibia involvement. Okay, so this is a class of PX tibia. So this one we need to fix. Let's roll. All right, face down.
Tender right here, huh? Yeah. How's that? Even more. See, so if you took an MRI right now, this left one, I'd not be surprised you have a Baker cyst in here. All right. So what a Baker cyst is, basically, it's all you have an articular joint, all right? An articular joint capsule that's surrounding your knee. Now, it bulged out quite a bit on the back over here. And that's what we're feeling over here. We're gonna pump some of this fluid and edema back into the joint. There we go. Now let's get some more of this. Here's a piece. Here's a piece. All right, walk around, champ.
It's gone too. Pain is gone too. Before, couldn't even. But before I couldn't even get that low.
Nice.
It's like I feel like I got a new knee. Yeah.
Ready for the last part?
What's the last part?
Oh, so 2 more parts. So let's go ahead. Let's work on your foot. Okay, on your back.
That's right. We got a whole new body.
It's almost like that scene out of the $6 Million Man. We have the technology. We can rebuild him. All right, so let's take a look. It's this left one over here. So we have the superior navicular. First things first, let's check the talus. Talus is fine. Navicular, yep. See, you do have a superior navicular, so it is stuck. So because it's cracked, it's been there for a very, very long time. We're gonna pump this fellow up. Okay, let's get a little more. There it goes. Okay. There we go. Okay, roll it this way. Just let it go. There it is.
I can't get up.
Yeah, you could get up.
Feel more stable. Feel a lot more stable than my right foot now. Yeah. I
Nice.
feel like taller. But definitely more stable than my right foot. Now my right foot feels like off.
Sweet. Ready for the last part?
Yeah.
Have a seat. Okay, go ahead. Blow. Yeah, it is diminished a bit on the left side. Try again. Yeah. It's about like more like 30% restricted on the right. I'm sorry, on the left side. So it's not too bad. Okay, stiffen up. So since they did surgery on this, here's the thing. They really did change, and it feels like they shaved off quite a bit of that septum off. Let's double check. Yeah, they did. They shaved it off a bit. Yeah, but you still have a tail piece of it right there. All right, Jim. Okay, on your back, face up.
be very gentle with this one. A little more. No, there's just not enough of that deviated septum in there for me to work on. But there is a nasal bone here. Okay, coming up. Let's see over there. All right, good. How's it? What's different in there?
I feel like I'm breathing in more air.
All right.
Yeah, definitely a difference.
Nice. Anything else, champ?
No, other than that, I feel great. Besides just the muscle spasms, because it's all tight still.
Mm-hmm. Well, again, that's to be expected. Just when you go home, just ice that fellow down over there.
Yeah.
All right, and then you're gonna enjoy that thing. It's gonna calm down quite a bit.
Yeah, I feel a whole new body. This is unbelievable. Appreciate it.
Hey, not a problem.
Definitely.
Okay.
Thank you so much.
Oh, you're very welcome.
Oh my God.